Now for your diagnosis, is it clear? So when you make your diagnosis, you can just say a sickle cell disease. It is a sickle cell disease. Is it clear? So say talk about sickle cell disease, complicated by, is it clear? Generally, you have to speak about the complication. Complicated by, you have to speak about, if it is an acute complication, you speak about the crisis, like vaso-occlusive crisis, like sequestration crisis, like aplasia anemia or hemolytic crisis. Is it clear? That's a complication. Complicated by, is it clear? Or you have a chronic complication like stroke. You have a chronic complication like, so you can speak about all those chronic complications like pulmonary embolism. Is it clear? Now, after complicated by, you have to speak about the precipitating factor. Precipitated by, is it clear? You have in the precipitating factor, you have to speak about the etiologies of hypoxemia or the etiology of hypoxia. The etiology of hypoxia can be acute pneumonia, it can be an acute asthmatic crisis. Is it clear? It can be acute pneumonia, it can be acute asthmatic crisis, it can be high altitude. Is it clear? You have complications like dehydration, complications like hyperthermia in the case of any source of fever like malaria. Is it clear? You have complications, etiologies of hypothermia, like any cause of cold. Is it clear? Or the child has drank cold juice. Is it clear? So all those are the elements like that you have to speak about. Speak about the complications, speak about the precipitating factor. Is it clear? And so those are the two major elements you have to bring out when you are speaking about the diagnosis of sickle cell. So now after speaking about the diagnosis of sickle cell, we now move to the next part now, which are the investigation of a patient that has sickle cell anemia.